Okay, great. Hopefully you can all see that. So as Alana has said, I have a split role. I'm a clinical psychologist, but I'm also a researcher, and I have a particular interest in both BDD, body dysmorphic disorder, and OCD, obsessive compulsive disorder. So for me, it's really exciting to be part of this amazing conference today. And I'm really happy to be able to talk to you about some work that my colleagues and I have been doing, looking at the question of whether or not detailed focus processing, by which I mean having a real eye for detail and sometimes finding it difficult to step back and see the bigger picture, if you like, whether this type of processing is linked with body image problems. And I'm going to talk about some research that we've done looking at this question in body dysmorphic disorder and anorexia nervosa. So I'm going to start off by talking a bit more generally about how BDD relates to other mental health disorders. And then I'll focus in talking about the links between BDD and eating disorders. And then I'll move on to this issue of detail-focused processing and talk about it as one possible example of a feature that BDD and eating disorders have in common. And I will tell you a bit about the results of our recent research in this area. And at the end of the talk, I'm going to talk about the implications of our research for treatment and recovery from BDD, because really that's our ultimate interest, and that was our motivation for carrying out this research in the first place. So I think everybody who's attending this session is probably already expert in BDD, either through lived experience or through training. So I'm not going to spend long talking about what BDD is, but just to briefly recap so that we're all on the same page. Body dysmorphic disorder is a condition that's characterized by preoccupation with flaws in physical appearance. And what's interesting is that these flaws really appear as very, very minor or even completely unobservable to other people. But of course, nevertheless, they're still a source of great distress to the person with BDD. And these concerns tend to be linked with repetitive, time-consuming behaviors that the person carries out in order to fix or conceal or check their perceived flaw in appearance. I think a really important question is, how does BDD relate to other mental health disorders? And this is really something that we're still figuring out. We don't have all the answers, but I'm going to talk about a bit about what we do know so far. So today's conference is on BDD and OCD, obsessive compulsive disorder, and it's no coincidence that these disorders have been put together. The reason that the BDD Foundation and OCD Action have linked up is because we know BDD and OCD are very closely linked. And that's reflected in the manuals that us clinicians use when we assign diagnoses. So we have two main diagnostic manuals. They're called ICD-11 and DSM-5. And within both of these manuals, BDD falls under the category of obsessive compulsive and related disorders, along with OCD and a range of other disorders. And the reason that these disorders, OCD and BDD, have been put together in this category is that they have very similar features. So one feature that they have in common is obsessional thinking. In the case of OCD, obsessional thinking might, for example, focus on fears of contamination. It might focus on a fear of harm coming to people. In BDD, obviously, the obsessional thinking is focused on the worries about appearance. So the content is different across the two disorders, but the quality of the thinking processes is very similar. So the thoughts and ideas tend to get stuck in the person's head. They're recurrent, they go round and round, and they're very powerful and difficult to ignore. And a second feature that OCD and BDD have in common is the repetitive behaviors that I mentioned. So in OCD, repetitive behaviors might include washing or cleaning, having to arrange things in a particular way, counting, checking. In BDD, the repetitive behaviours that we commonly see are things like excessive grooming routines, so having to do your hair in a very particular way, camouflaging through clothing, through makeup, having to check your appearance repeatedly, for example, in a mirror, and comparing your own appearance to that of other people. So again, the behaviours themselves are different in OCD and BDD, but the quality is very similar. In both cases, people describe these behaviours as being feeling compulsive, feeling that they have to do them in order to cope with day-to-day life, even if these behaviours are very time-consuming, place a big burden on them, and really interfere with their day-to-day life. So it's really clear that OCD and BDD have strong commonalities, but of course BDD has a lot in common with several other mental health disorders as well. And on this slide, I've just put what I think are some of the most important ones for us to be thinking about when it comes to understanding BDD. So you can see at the top the overlap between OCD and BDD that I've talked about. But we know that BDD also has a lot in common with social anxiety disorder. So both BDD and social anxiety disorder involve a really intense fear of negative judgment or negative evaluation from other people, and therefore often quite intense anxiety in social situations. And BDD also has a lot in common with depression. So both of these disorders involve a profoundly negative view of oneself. In BDD, that may be mostly centered around appearance, although often I would say extends beyond appearance. And in depression, the negative view of oneself might be quite pervasive and encompass appearance. So there's definitely overlap there too. And at the bottom of the slide, you can see I've put eating disorders. So like BDD, most eating disorders involve body dissatisfaction and a sort of really poor body image. And I think this is such an important area, which actually hasn't been researched very widely so far. And it's an area I'm going to talk more about today. So what are the links between BDD and eating disorders? I've mentioned that BDD and eating disorders share many features. So perhaps most obviously the fact that they involve poor body image and a sort of disturbance in body image. So people with BDD and eating disorders tend to see themselves differently to how other people around them see them. We also know that both involve these repetitive behaviors that I've touched on. So I've mentioned some of the repetitive compulsive behaviors that we see in BDD, but they're also really common in eating disorders. So for example, somebody with an eating disorder might have to count calories. They might have to, in a sort of very sort of repetitive way, have to monitor the amount of food that they're eating. They might have routines that involve checking their body. And they might have routines involving exercise. And often these behaviors are things that they have to do very frequently and in a very specific kind of routine and ritualized way. There are also similarities between BDD and eating disorders in what we call sort of epidemiology. So for example, both disorders typically develop during teenage years. That's the most common time at which they arise. And that's a little bit different, for example, to OCD, which in young people has a slightly earlier age onset and usually emerges in late childhood. And we also know that BDD and eating disorders are more common in women. Of course, they can affect anyone, but I think it's been well recognized for a long time that eating disorders are more common in women. For example, 90% of patients with anorexia nervosa are female. The picture's been less clear with BDD, and I would still I'd say it's still not completely clear. There's a bit of a question mark around it, but recent studies have shown that particularly in young people, BDD seems to be more common in girls. Studies in Sweden and in the UK have shown that BDD is 6 to 9 times more common in teenage girls than boys. So there's a lot in common between BDD and eating disorders, but of course there are differences too, which are really important to recognize. So I've put on this slide some of the main differences. So eating disorders tend to involve appearance concerns that are about overall body weight and shape. And linked with those concerns are unhealthy patterns of eating behavior. So restricting, binging, and purging, for example. And these eating behaviors are designed, or the motivation behind them is to lose weight usually. So that's different to BDD, where the most common appearance concerns that we see are concerns about facial features. Although I think it's really important to acknowledge that this varies widely, and with BDD, people can worry about any part of their body, and it's often multiple parts of their body. And unhealthy eating or disturbed eating isn't a core feature of BDD. Having said that, eating can certainly be affected. So, for example, somebody with BDD might avoid eating oily foods for fear that it's going to have a negative impact on the quality of their skin. So the motivation isn't weight loss, but there's still a disturbance to their eating. But what I really want to highlight here is this big overlap in the middle, this big gray area. And in my experience, and I think many clinicians would agree, patients don't necessarily neatly fall into one or other of these categories. And there really is a gray area in the middle. And I think that's really well demonstrated when we think about a particular difficulty called muscle dysmorphia. Um, so muscle dysmorphia is a form of BDD that most commonly affects men, and it's defined by a concern about lacking muscularity. So people with muscle dysmorphia worry that they're too small, they worry that they are not muscular enough, and they go to great lengths to try to increase their muscle bulk. And that often includes increasing their dietary intake, particularly of protein-rich foods, as well as lots of exercising and excessive working out. So if we think about this form of BDD, it is characterized by concerns about overall body shape and weight, like eating disorders, and it can be linked with really unhealthy patterns of eating behavior. And actually, in the past, muscle dysmorphia was formally diagnosed as a form of eating disorder, and people used to talk about it being reverse anorexia, because instead of worrying about being too big, people with muscle dysmorphia were worrying about being too small. But actually, that's changed over time, and in the current diagnostic manuals, we include muscle dysmorphia in the diagnosis of BDD. So somebody coming along with these difficulties now would get a diagnosis of BDD. So I think this just really demonstrates how muddy the waters are when it comes to sort of separating eating disorders and BDD. And of course, as well as this kind of overlap and sort of muddy area, it is possible to have both disorders at the same time. And actually, that's quite common. So estimates have varied, but some research studies have shown that 1 in 3 people with BDD meet diagnostic criteria for an eating disorder. And similarly, 1 in 2 people with an eating disorder meet diagnostic criteria for BDD. If you ask the right questions, if you screen for it and assess for it, you find it there. So this shows that BDD and eating disorders often go hand in hand, although obviously that's not the case for everybody. So you might be thinking, well, why is all of this important anyway? Why does it matter if we understand the links between BDD and other mental health disorders? Well, I think it matters for a few reasons. One is that if we know, for example, that BDD has really strong links with eating disorders, It tells us that clinicians working with eating disorders should be on the lookout for BDD. They should be actively screening for BDD. They should be asking the right questions. And if they do that, it's going to help us improve detection and diagnosis of BDD. And this is so important because we know that BDD tends to go undiagnosed for many, many years, often decades, before an accurate diagnosis is made. And that means, of course, that people are suffering in silence and they're not getting the right treatment at the best time. I think understanding the links between BDD and other disorders is also important because it can help us figure out who might be vulnerable to developing BDD in the future. At the moment, we don't have very much information about who's at risk of developing BDD. And this is one route into that, and it will help us think about prevention programs and early intervention, which is very much needed. And it's very likely that the earlier we can intervene, the better the outcomes will be. But also understanding the links between BDD and other disorders might help us improve treatments. So as I'm sure many of you are aware, BDD is really quite an under-researched disorder still, and that includes its treatment. So fortunately, we do have effective treatments for BDD, but I think there's still room for improvement. And if we understand how BDD relates to other disorders, we might be able to draw on knowledge of how to treat those other disorders and sort of borrow techniques, if you like, from the treatments of those other disorders in order to further develop and improve the treatments and outcomes in BDD. So I'm going to sidestep now to talking about this issue of detail-focused processing that I mentioned at the beginning. And I think this is one example of a feature that BDD and eating disorders may have in common and that might give us some clues to treatment. So I'll just explain what I mean by detail-focused processing. When most people look at a visual image, a picture or a reflection, they tend to focus on the sort of global, bigger elements of the picture, the bigger picture, before they hone in or zoom in on details. So that's well established. That's the sort of average way of looking at a visual image. But some people have much more of an eye for detail, and they do the opposite. They focus on details before the bigger picture, and sometimes they actually struggle to sort of zoom out, if you like, and to sort of process the picture as a whole. They get stuck on the details. So this is a little bit like that sort of idiom that we hear, can't see the wood for the trees. That's saying that you can't see the wood, the sort of bigger picture, the overall picture, because you're so caught up looking at the trees, the sort of details, the individual components. And of course, there might be loads of advantages to having a very detailed focused processing style. It might be really helpful in certain occupations like design, for example, but there might be certain drawbacks too. If you're really detail focused in your processing, when you look in a mirror, you're going to be much more likely to notice minor flaws or differences or little blemishes in your appearance. And not only that, but once you notice those, it's going to be really hard to contextualize them within the whole of your image. So rather than sort of saying, oh, look, I've got a pimple on my chin, but actually overall my face kind of looks okay, it's much more likely that you'll get sort of stuck thinking about those details and focusing on those details and struggle to kind of contextualize it within your whole reflection. And in addition, we know that people with a very detail-focused processing style actually tend to have quite a fragmented or piecemeal perception. So they look at detail to detail and really do struggle to see the overall picture. And what that can mean is that it can, in some situations, slightly distort your perception or lead you to sort of see things in a different way to other people. And I think a good way of thinking about this is it's a little bit like looking at individual pieces of a jigsaw puzzle. And if you look at each piece individually without it being sort of put together, you might get quite a different impression of what the overall picture of the jigsaw puzzle is. So the culmination of all of this, picking up on minor flaws, finding it hard to contextualize them, having this sort of fragmented processing style, and which might impact on your perception. The culmination is that it might lead to, or at least kind of fuel and maintain, poor body image. And detail-focused processing is something that us researchers are able to quantify. We can measure it, and we've got a whole range of different tools and techniques for measuring it. And I'm just going to show you one example. So this is a task that we might give to somebody, and we say, this is a target face at the top. Can you pick which of the two faces at the bottom match up to the face at the top? And that's a pretty easy task for most people, and we measure their reaction times. But the real test of detail-focused processing comes in a second version where we turn the faces upside down and we ask the same question. We say, which of these bottom faces match the top one? And actually, if you have a global processing style, you tend to see kind of bigger elements of the picture. This is a hard task because you'll probably just look at all these upside down faces and say they're all faces of a female. She has blonde, fair hair, and it's tied in a ponytail. And it's pretty hard to differentiate the bottom two and work out which one matches. Whereas if you have a much more detail-focused processing style, you have that eye for detail, you're going to notice the differences more quickly, and you'll see, for example, that this top person has a center parting and this person has a center parting too, whereas the person on the left has a side parting. So it's going to get you to the answer quicker, and you're going to figure out these two match. And that's so in this way, detail focused processing actually enhances your performance in this task and means that you have quicker reaction times. So we can measure reaction time, and that gives us an indication of detail focused processing. So using a whole range of tasks like that, and they're not all involving faces, some of them involve very neutral pictures like houses or letters. Using these kind of tasks, many studies have shown that people with anorexia nervosa have a more detailed, focused processing style than people without mental health difficulties. So that's been pretty clearly shown. But what we were interested in, my colleagues and I, is do people with BDD have this same eye for detail? And we had a quick look at the studies that had been done. There had been quite a few studies, but it was clear that the findings had been mixed. And that's pretty common in any form of scientific research. Your findings are going to really depend on exactly who took part in your study, the methods that you use to assess the processing style, the way you analyze the data. So it's not uncommon to have mixed findings. But what we weren't sure about is which way the scales were tipping. You know, it wasn't clear whether overall the finding was a yes or a no. So in this situation, there's a tool that we can use to summarize the results of previous studies and to sort of answer the question of overall, what are they showing? And that method or technique is called a meta-analysis. So my colleagues and I decided to undertake a meta-analysis to look at detail-focused processing in BDD and anorexia nervosa. And this study was led by Katie Lang, who's also based at the BDD clinic for young people at the Maudsley Hospital with me. And this meta-analysis technique essentially averages the results across previous studies. It does it in quite a clever way. For example, it gives a slightly greater weighting to bigger studies, which we know produce more reliable results. And so our first step was to really systematically search through the literature to find studies that had been conducted on this topic. And we found 16 studies on people with BDD and 18 on people with anorexia nervosa. And you can see that that equated to 299 people with BDD in total across these studies, and 518 people with anorexia, and similar numbers of healthy controls. And by that, what we mean is people who didn't have any mental health disorder. So we found these studies, we summarized the results, and we used a meta-analysis technique to summarize the results. And these were the results that we found. And I really appreciate that this is not a nice figure to look at. So I'm just going to talk you through it and pull out the most important points. So on each row here represents a different study. So we've got our 16 BDD studies down the side. And on this side, the dots actually show the results of the individual study. And where the dot appears on the left-hand side of this vertical line, it shows that people with BDD had a more detailed focus processing style than the healthy controls, than the people without BDD. So you can see that there's a bit of a mix, of a bit of a scatter with these results, which is what we'd expected. But what's really important is this diamond at the bottom, and this is the summary statistic. So when we average out the results of all the previous studies, this is the overall finding. And you can see it's on the left-hand side of this vertical line. So it's showing us that people with BDD do have this slightly over-detailed processing style. We did the same thing with the studies for anorexia nervosa and found a really similar pattern. So really our kind of headline, our main message from this study was that yes, people with BDD and people with anorexia nervosa do tend to over-focus on details of visual images compared to people without mental health disorders. Our research can't answer the question of why that is. We don't know whether this is a trait that these people have always had and perhaps made them vulnerable to developing the disorders in the first place. Or on the other hand, perhaps it is something that arises as a consequence of having BDD or an eating disorder. Maybe it's a sort of symptom, if you like, of having these disorders. So there's a bit of a chicken and egg question. We don't know which one has come first. But what we do know is that this over-detailed processing style is probably unhelpful if you have body image problems, and it's likely to fuel and maintain BDD. So that really brings us on to thinking then, what can we do about it? Why is this important? What does this tell us for treatment of BDD and for BDD recovery, which is really the most important question. So I think generally what it tells us is that we need to be promoting, encouraging, or actively training people with BDD to pay attention to sort of the bigger picture, to focus on big elements rather than details. And that could be, for example, when they look in a mirror, when they look at their own reflection. We do have a technique already that kind of does that. So this is a technique called mirror retraining, which is often used in cognitive behavior therapy for BDD. And really, mirror retraining is about helping people to see themselves as a whole and to not get really fixed on the details, the parts of their appearance that they feel most concerned about when they look in the mirror. So what we do is we train people to scan their body from head to toe, not focusing on particular features, but instead sort of looking at the sort of overall picture, the overall reflection. And the second layer to mirror retraining, which is really important as well, is that we train people to look at themselves in a very objective way. So to describe their reflection in quite factual terms, without sort of any negative comments or descriptions. So it's about being non-judgmental and objective, and really learning to sort of spot those critical thoughts or the kind of bully voice that sometimes comes in for people with BDD when they look in the mirror. So our research suggests that this technique of mirror retraining could be really important and a really helpful component of CBT for BDD. But training people with BDD to look at the sort of bigger picture and to engage in global processing doesn't have to just apply to looking in mirrors. So we know that people with BDD focus on details in a whole range of situations. It's not just when they look at their own reflection in the mirrors. It's not just when they look at faces. So if we know it's a sort of global trait, then perhaps we should be trying to address it in a wide range of situations as well. And there's a psychological intervention called cognitive remediation therapy that really does exactly that. So cognitive remediation, or CRT as it's sometimes called, is a psychological treatment that is often used in eating disorders. And it's often referred to as brain gym because it's a series of sort of mental exercises and puzzles that are designed to change your thinking style. So for example, to promote flexible thinking and not be so kind of rigid and rule bound, but also to promote bigger picture thinking, global processing. And I think what's really interesting about cognitive remediation therapy, certainly compared to CBT, is that it's very neutral content. So it doesn't involve talking, or at least no sort of detailed discussions of appearance concerns or body image. And I think that can make it much easier to engage with actually for some people, because we know that talking about appearance worries and body image can be really, really hard for people with BDD. So with CRT, we don't have that barrier. It's quite neutral content. And I think it's important to say this isn't a standalone treatment. It tends to be used in combination with other treatments like CBT. And the idea is that if you combine it with CBT, it might improve outcomes. So I'm just going to give you one example of the kind of task that somebody might do if they were receiving cognitive remediation therapy. So they might be shown a picture like this and told that they need to describe this picture to another person who can't see it themselves. And they need to describe it in a way so that the other person can draw an accurate sort of replication of the picture. Now, if you have a very detail focused processing style, what you're going to do is hone in on very specific elements of this picture and sort of work your way through them one at a time. So for example, you might say, okay, I want you to start off by drawing a small triangle which has got a slightly curved bottom. And then to the right of that, I want you to draw a slightly larger triangle, which is slightly lower down and it's got a bit of a curved top this time. And you can probably see quite quickly that if you carried on like this, it would take a really long time to describe the picture, but also it would be hard for the partner, the other person to be drawing, be quite hard for them to produce an accurate replication of the picture. So it wouldn't be a very good strategy. Whereas if you engaged in global processing and sort of described the bigger features, the overall features, you might say, start off by drawing a diamond in the page, and then I'd like you to draw a cross on top of that that's centered on the diamond and about the same height. And that's going to be much quicker and also much easier for the person drawing. So this task is kind of cleverly designed to really encourage people to try to engage in that global processing style, to pay attention to the big features and not zoom in on the tiny details. And CRT, cognitive remediation therapy, involves a really wide range of puzzles and tasks that are a bit like this. And what we know is that they are actually really effective in changing people's thinking style. And that's been shown in anorexia. So you can train people to think more flexibly. You can train them to pay attention to the bigger picture. And really importantly, there's research to show that when you add cognitive remediation therapy into treatment as usual for eating disorders, so that involves CBT as well. So when you add CRT in, it actually leads to better treatment outcomes for people with anorexia. So I think this is a really exciting area for research in BDD, and we need studies to test this out and see whether or not cognitive remediation therapy could help improve our treatments and outcomes for people with BDD. So I'm just going to finish with a quote from a young person who I worked with, and he had come to the end of a course of CBT for body dysmorphic disorder. And I really liked this quote. It sort of jumped out at me because it's something he said spontaneously, but I think it really captures the importance and the benefit of global, bigger picture processing in the recovery from BDD. So he said, when I look in the mirror, I still see things I don't like. There are parts of my face that I'm not happy with, but I don't get stuck on them anymore. I realize that now I look at myself as a whole, and when I do that, I'm okay. So I'm going to finish there. Thank you so much for listening, and I'm really happy to take any questions that you might have.
Thank you so much, Dr. Georgina. We've got some questions that came through, so I'm just going to read them out and then you can answer them live, and I'll keep an eye on if any more come in. So the first one is, how commonly is BDD related with orthorexia?
That's a really good question, and I don't think we have data on that at the moment. I think it would be a really great area to study. As I say, we know there's this relationship with eating disorders, but there haven't been studies looking specifically at orthorexia as far as I know. And, you know, I think the truth is that there's so much we don't know yet about BDD. It is a really under-researched area, and it's just so important that these kind of questions are flagged up so that us as researchers know, you know, where we should be focusing our efforts and the kind of things that we should be trying to tease apart in the future. So thank you for the comment, and sorry, I can't really answer.
So the next question we had that came through was, if you have high feelings of self-worth and a secure attachment style, could detail-orientated processing be a problem or an asset versus those with lower self-esteem and an insecure attachment style?
Yeah, I think that's a really good point, because I wouldn't want to suggest that detail-focused processing style is a negative, a blanket negative, because it certainly isn't the case. And I think a lot of people can flit in and out of different processing styles as well. So I think, you know, some people are quite adept at sort of knowing when they're engaging in a task that requires them to be quite detail focused, and they can use that to their advantage, but they're also able to sort of recognize the way that they are dealing with information and switch to a more global processing style when that's needed too. And I think it's probably only going to be problematic in terms of body image for people who have certain other vulnerabilities as well. So, you know, there's certainly I wouldn't want to suggest that detail-focused processing style is going to be a risk factor for BDD for everybody. It would be one piece of the jigsaw, and there are many other factors. So, for example, you know, a genetic vulnerability or predisposition, certain life experiences that you may have had. If all of that comes together, then it might create this sort of perfect storm and an impact on poor body image. So yeah, in terms of your question, I think the opposite might be true. If you've got very protective factors, you know, like very positive sense of self-worth or really strong attachments, all of those protective factors will play a role in sort of reducing your likelihood of developing body image problems as well.
Thank you. We've got another one here which is asking if this attention to detail is a characteristic shared by people with OCD as well.
Oh, that's a great question. Yes, and I've been sort of talking about the relationship with eating disorders, almost suggesting that it's an alternative to the relationship with OCD. And I certainly don't, you know, think that. We know that OCD is also very closely related to eating disorders. So I think there's a bit of a triangle with OCD, eating disorders, and BDD. And yes, there are studies showing that people with OCD also have this detail-focused processing style. a bit like with the starting point that we had before our study, with BDD, the findings have been mixed. So I think with eating disorders, it had always been quite a clear picture. The findings were pretty consistent. With OCD, the findings have been a little bit mixed. So probably what we need to do is a meta-analysis looking at it in OCD, so we can get that kind of summary view and see overall where the land lies.
Okay, we've got another question here, which is asking if there are any links with BDD and binge eating disorder.
Yeah, that's another great question. As far as I know, the studies looking at the links between BDD and eating disorders haven't really teased apart the different forms of eating disorders. And I think that's going to be really important because it's such a broad category. I mean, today I was talking about anorexia nervosa because there has been more research on that. So I don't think we know a huge amount about the links with other forms of eating disorders, but that's really important for us to understand, particularly because most people with eating disorders don't actually fall in the category of anorexia, and most people do have these other, kind of more EDNOS eating disorder, not otherwise specified, or binge eating disorders. And often people move around within these categories as well if they have an eating disorder. So I think it's going to be something that's important for us to look at in the future.
We've got 3 questions here that I think are very closely related. So someone's asked if there are any apps you would recommend for cognitive remediation therapy. Somebody has asked if there are how you can get access to exercises or puzzles that you described. And another's asked if there are any references available for CRT online, or should it always be supervised?
I believe there are some apps and online CRT programs. I haven't actually used them myself, so I don't know off the top of my head what the references would be, and I also don't know exactly what the content is, so I wouldn't want to necessarily be recommending them. But I know they do exist. They haven't been developed specifically for people with BDD. I would probably say that at this stage, although I think it's a really exciting area for future research, and we've got some data to show that CRT is helpful in eating disorders, we haven't actually looked at that thoroughly in BDD. So I think that's something that we need to do first. We need to properly evaluate it and check that it really is helpful, so that people aren't channeling their efforts and energy into something that isn't really going to make a difference in their life. So yeah, in terms of accessing resources, I think there are resources available, there are apps available, but they're not specific to BDD. And I would say, we probably need to do the research first to check that it works before we go down that route.
Forgot to unmute myself. I think we're having lots more questions coming in. We've probably got time for a few more if you'd be happy to answer them, but I'm not sure we'll have a chance to answer all of them. I'm just going to go down the list. So someone's asked, is BDD circuitry the same as OCD circuitry?
By circuitry, I'm guessing that we're talking about the sort of the neural circuitry in the brain. I think that's probably the question. So I think there are similarities, but there are also differences. So a lot of the neuroimaging studies, so the studies that have looked at neural activity in the brain in people with BDD, have focused on the sort of visual circuitry. Because of this issue that people are really trying to understand, why is it that people with BDD see themselves in a different way to how other people see them. So it makes sense that there's something different happening in the sort of perceptual circuitry. So that's been the main focus of research in neuroimaging studies of BDD, and that isn't so relevant in OCD. So I think, yeah, to answer your question, there are some commonalities and overlap, but also there is some evidence to suggest differences in the sort of visual circuitry within the brain in people with BDD.
Someone's just shared that there's not a question, but just a massive thank you for this, that everything you said rings true for them and it makes so much more sense to them now. So they really appreciate it. So I just thought I'd let you know that.
Oh, thank you so much. That's a really lovely comment. Thank you.
We've got someone who's asked, how can we be involved with BDD research?
Oh, that's a great question. I know the BDD Foundation often promotes and advertises specific research studies that are happening. And, I think if you're willing to take part in research, that would just be amazing for us as researchers, because BDD is often undiagnosed and undetected. It's actually quite hard as a researcher to recruit people with BDD to a study. It's quite hard to find those people. So yeah, if you are interested, I think the BDD Foundation website's a great place to look. And I know any researcher, I can speak for all researchers interested in BDD, they would be incredibly grateful for your support.
Thank you. We've got someone here that's asked, we know that autistic people can have a more detailed focus processing style, and that OCD and eating disorders are more common in autistic people. They're not sure about BDD, but they were wondering if there's any research that's looked at these links.
No, that's a great question as well. That's something I've thought about too, because you're right that we know there are strong links between OCD and autism spectrum disorder. Those disorders often go hand in hand. And it may be that that's partly to do with the sort of thinking style, so detailed focus processing, sometimes quite sort of difficulty thinking flexibly and being quite rule bound. And that does seem to apply to BDD. You're right that there aren't studies looking at BDD and autism spectrum disorder. That's something that we as a clinic are very interested in looking at. So watch this space. But I think my hunch would be that there is a relationship, partly because of this processing style, but I think also, people with autism spectrum disorders are more likely to experience interpersonal difficulties and negative interpersonal experiences, which often are quite relevant to people with BDD as well. So they often describe that they've had sort of interpersonal difficulties, maybe negative comments from other people, and that's been a real sort of powerful experience that's shaped their view of themselves and fed into their body image problems. So I can see several different routes for how BDD and autism spectrum disorders could be linked.
Thank you. I think we've probably got time for just one more question, which is a shame because there's lots of really good ones coming in. But this person's asked, is there a connection between increased detail orientation and striving for perfection, which might be observed in BDD sufferers?
Yeah, really interesting. I don't think that's been looked at explicitly, but it would certainly make sense. And we know separately, the study that I've talked about today, that detail focused processing is clear in people with BDD. And also we know that perfectionism is common in people with BDD, and we've done separate studies looking at that. Particularly what we call self-oriented perfectionism. So people with BDD often set very high kind of internal standards for themselves. It's not necessarily that they think other people have high expectations for them, but they set very high standards for themselves. And then when they fall short of those standards or think they've fallen short, they're incredibly hard on themselves, very critical. So it's that kind of critical element of perfectionism that I think is really important in BDD. So yeah, great comment, thank you.
Thank you very much. I think unfortunately that's all we've had time for, but I'm sure people really enjoyed listening to that. So thank you.
Well, thank everybody for the questions. They were really great questions and given me a lot to think about.